Well, I thought I might be asked about the mission and how to do it. And I tried to think, what story would indicate who we were? Mm-hmm. There's no one story.
Right. We've been able to get involved and build a presence and through the work of our operational leadership teams here, and that has really become a great solution for many communities across the North Country who may not even realize how close they were to have lost access to care, which we believe is really a foundational element for the health of towns.
The challenges are kind of access, poverty, lack of ability to get insurance in those days. So we had to try to figure out lots of ways around those challenges.
Our emphasis is always on patient care first. Many of our patients came to our health centers, and some of them could be acutely ill, and they probably belonged in an ER or a hospital. But again, we have such geographic challenges that a lot of patients would come to the health center, which would be much closer, hoping that they could be taken care of there.
There was a lot of spirit of cooperation. We get on the phone and help each other out. It's what people needed, access to care at different hours, having ability to, if you can't afford to pay, have a sliding scale, things like that to give you access. And then certainly having the wherewithal to go in and tap from the state and the feds to do that, to create the mission.
At Hudson Headwaters, we're really fortunate. You know, we do not spend really any time looking at what kind of insurance a patient has, or some people don't have any insurance. So we treat all comers, and that's been just a great strength of the network. And in some towns, really small towns, we really are the only provider. So we definitely see that economic diversity.
And nobody was talking about productivity. Nobody was talking about insurance companies. I can remember John agonizing over increasing the price of an office visit, which was basically from $10 to $12.
Yeah. We were really finally succeeding in taking care of everybody, seeing the rich and the poor and everyone in between.
Healthcare became more and more important. And we found that a viable community is predicated on adequate healthcare and good access. And when we became aware of this opportunity, we were very, very interested in doing everything we could to accelerate the access to good health care for the residents of the region.
We had an underserved population in Glens Falls who had no insurance, so they were underserved, not geographically, but financially. So we were able to provide care there.
We're here to serve the public.
One of the best rural health networks, or the best probably in the country.